My name's Jonathan Ruzicka. I'm a doctor of physical therapy, and you'd think that I wasn't sitting all the time, but I'm probably like an average American. Average Americans, Harvard Health found that we sit, when you bring in work and leisure activities, 10.4 hours a day on average. We all sit too much. The rest of the world, it's almost half that, between 5 and 6 hours every day that they're sitting. In the 1960s, nearly 50% of jobs had some type of moderate physical activity. Now it's less than 20%. That's kind of terrifying. So I'm seated right now. You can see where I'm tight. My knees are bent. My hips are bent. I'm in hip flexion. I'm rolled forward. We call it the office gremlin, where we type in this position. That rolls my shoulders forward. My neck goes up into extension, and I'm only moving through my lower back right here. So that causes all kinds of problems. We're not going to change your job. We're not trying to change your job or your work life. What we want to do is put together a clear, concise program of what you can do to unravel the seated position so that we can stay out of pain, stay away from the doctor's office, not be taking pills, getting injections, or actually having surgery when it's totally unnecessary. Let's get right into the exercises. Major joints that we need mobility in is through the thoracic spine, through the hips, and through the ankles. I got a ton of videos on that, and you can check them out. Hit the subscribe button. Make sure that you hit the bell icon so you get notified when we put these videos out, especially if you make a comment. Let us know in the comments what you need, what information you need, or where we need to describe something more so that you can get results from your own home. So we're going to get right into the exercises. We'll leave in the description one of our videos that talks about why we need mobility here, here, and at the ankles. But first thing, let's attack the ankles because that's what's protecting us from the ground. What I want to do is 3 things. We call it the ankle trio. So first thing I want to do, get up against the wall, and I just want to spend a minute with my heels up. So I'm engaging the muscles in my calves. Isometrics, getting your heels up, maintaining that position. When we do that consistently, it decreases our pain levels in our ankles significantly because we get ground substance around the attachments to those muscles. And we're training those muscles, but we're using it because we want to get blood flow to the calves before we stretch them. And then we're going to use the muscles on the opposite side to increase the mobility and take up space so that we can bend our ankle more. We've got to maintain ankle mobility if we want to walk normal, run normal, have any type of physical activity. We have got to have our ankle mobility. So that's 1 minute. You can come down and up, not all the way, but down and up. Just think about setting a timer. I got a minute. I'm going to hold this up. Really safe exercise, especially if you're having foot and ankle pain, plantar fasciitis. Really safe to just get up and hold it. Where it gets dangerous is when people start stretching through it and holding it down here, and that's where they pop and get little tears. We want to avoid that. So we're just engaging the muscles up like this. So that's our first thing of the ankle trio, is we're engaging those muscles and doing a heel raise. The second part is I'm going to get up against a chair or a wall, but I'm going to push my heel down. And so now I want to keep my left leg right underneath my knee, and I'm pushing my heel down. I feel a big stretch right here up through the top of the calf because my knee's straight. So I'm going to hold that for 30 seconds. And then what I'm going to do is I'm going to bend the knee, and that stretch spot is going to move. So I'm going to bend the knee, but I got to keep the heel down. This gets a little bit harder, but now that stretch has moved into the back of the ankle right here. And then also in the front, I get a little bit of a joint mobilization pushing back with that knee bent. And I'm holding that for 30 seconds. We want to do both sides. It's really important. Even if we have pain only on one side, our body works together reciprocally when we walk. So we need to make sure we're doing both sides. So I switch here, knee straight, feeling a really good stretch in the top part of the calf, 30 seconds, and then I'm going to drop that knee. Just get a little soft knee, keep the heel down, holding that for 30 seconds. That's number 2. So number 3 of the ankle trio is now I'm going to get up against a wall, and I need to bend that ankle up, because when we're walking, we're looking for dorsiflexion. I need to be able to bend to 10 degrees. If I can't bend to 10 degrees at my ankle, then my knee's going to bend early, or I'm going to push off of my toe and I'm going to create a bunion or make a bunion worse. So I'm getting this ankle bend. It's called our anterior tib, and we call these toe raises. So what I'm going to do is get up against a wall right here, flat back, knees straight, knees slightly bent, both of them might as well. But if they're totally straight, then we have the resistance of a big muscle right here. So if we have a little bit of a knee bend, I like that better. So I'm getting right here, and I'm gonna raise my toes up, my my ankles up as high as I can, and I'm holding it for 10 seconds. And then I'm slowly lowering down. And then I'm holding it up for 10 seconds. When I'm slowly lowering down, I want it to take about 5 seconds. So if I do this 4 times, that's about a minute with engagement of these muscles. So as high as I can. You're gonna notice that it's hard to keep getting the ankles up as high because these muscles are weak. We don't work them. Like, we gotta start working these muscles if we wanna get long-term improvement. Come in here, if you start getting sore, come closer to the wall. It's easier. We get closer to the wall, raise up, holding it for 10 seconds, as high as you can. This starts to burn. And then slowly take 5 seconds lowering down. That's the ankle trio right there. So those first 3 things, we want to do this routine twice a day because we're sitting for more than 10 hours a day. We got to get these ankles mobile. So number 2, we need to get into our hips. We need to get hip mobility and hip stability. So when I go down, I can do a figure 4 stretch or I can do an active pigeon. So I'm laying down on my back. I'm going to put my hand across, pulling my knee up to my opposite shoulder. Do not press the knee. That's terrible information. When people press the knee, now you're pushing the femur up into the joint and we're causing hip impingement. So what I want to do is pull this knee, pull this leg up to my opposite shoulder right here. And I rest down, pull up to that shoulder, holding it for 20 seconds, 5 seconds pushing, holding it for 20 seconds, 5 seconds pushing, and then holding it for 20 seconds. And I do both sides. The progression to that, and if you can tolerate it, you can get on your knees, is doing an active pigeon where I come here, I drive my leg back, my back stays in a neutral position, and then I'm holding it for 20 seconds, and then I use these muscles, pressing down into this leg, pushing up for 5 seconds, and then I slowly lower back down, and my elbows get bent so my back stays in neutral, and then I'm holding it for 20 seconds, and then I take that 5 seconds driving back up, and then I drop down, but my pressure is coming straight down, my pelvis towards the ground. And then I just switch. When I switch sides, I drop my right leg under my left and then lift my left leg up and come back. And then I'm falling down into my pelvis into the mat right here. I don't want to twist over to the side, and I don't want my elbows extended where I'm just stretching my lower back, because that's not what we're going for. We're going for hip mobility right here. So same routine of 20 seconds on, 5 second push, 20 seconds in the stretch, 5 second push, 20 seconds in the stretch, getting down a little bit lower each time. And then so now we've got our hip mobility opened up. Now we need to use the hips. So number 5 is we're doing a hip hinge. So I'm gonna get this chair behind me. I wanna be about this distance, about where my toe is from the chair. So if I measure right here from the chair, where my toe is, slide this foot over to the side. And then now my lower leg is like a stake being driven into the ground. It's completely vertical. My face stays in line with my chest, and I push my butt back. And I push my butt forward. This stays in neutral. Make sure you don't lock your eyes on the wall, because I locked my eyes on the wall and I just went into back extension. You can see it right here. Now I'm not using those hamstrings. I'm just using my low back muscles, and I'm going to irritate it. We don't want to create new problems when we're trying to fix another problem. So we got to make sure that we're doing the right stuff. Leave us a comment, ask us any questions. We're going to answer them. So face stays in line with the chest, pushing my butt back. Really nice and controlled motion. Another thing that I see quite often is when people get to the top, they'll squeeze their butt. If we do that, what happens when I go to squeeze my butt is I do this. And I do back extension again. So we don't need to do that, because we use our glutes and our hamstrings when we get to the bottom right here. They're really activated. And they're gonna get more and more activated when you're consistent with this. So I'm engaging here. I just come up to neutral, to a soft position. And I'm gonna do 30 of these. So typically we break it up into 2 sets of 15 or 3 sets of 10, but we wanna make sure that we're firing up those muscles. We gained the hip mobility. Now we need to use those muscles so that we maintain the hip mobility. Now, number 6, this is a pretty quick routine. Shouldn't take more than 6 to 8 minutes, unraveling that seated position, but we're sitting for 10 hours. We want to do it twice a day. So The last thing that we need to do is work on thoracic mobility. I would love to give you an exercise for thoracic strengthening as well, but in this video, we're gonna focus on thoracic mobility because that's where I see people miss quite often. So the first thing to do is you can lay on a bed or a table or a yoga mat. So I got a yoga mat right here. So I'm gonna lay down. So getting down to the ground, getting off to the side, and I'm just gonna lay flat on the ground with my knees bent and put my arms out to the side. If I get pain in my shoulders right here, then I'm gonna put my palms up right here to the side of my body. I don't wanna cause extra pain. Right here, I can put my hands on my chest, up here on my belly. I can put my hands down like this. What I don't wanna do is put my palms down like this, because what that did was make my shoulder curve forward. That's normal. So now if I open up my palm, then this flattens out and I'm working on thoracic mobility and shoulder blade mobility. So, and all we do when we get here is we take 5 breaths, breathe and relax. It's good to gauge and just do a minute. Like think about doing a minute, 5 breaths, and moving those arms around. If at the front end you can only do this, once you get 2 days in, let's see if we can get out to this position. So get out to here, then see if we can start getting to here. But always start at the easy one. You'll start breathing, deep breaths, sinking into the ground. And then what we want to do is get to a point where we can do this with our chin tucked, knees bent, and I can lay like this, and you can see my right arm touches the ground, my left doesn't as well. So maybe I need to start doing this a little bit more. I should be able to get both arms down. I can get it to touch, but it doesn't relax in that position. And that's something that I can control. So our first progression is getting a sweat towel, dish towel, something, we roll it up. We put tape on them here, but that dish towel, what I'm gonna do is go sideways against my spine. I'm gonna be underneath my shoulder blade. I lay back. This is gonna be, we want it to be slightly uncomfortable, but not painful. And so I chin tuck, knees stay bent, hands are on my belly. Hands can be here, hands can be here. But I'm gonna take 5 breaths with the towel roll right underneath my shoulder blades. That was 2, but we're gonna do 5, okay? Then I'm gonna lift my head up, I'm gonna shimmy down about 1 inch. So now I should be at the base of my shoulder blade. Visualize sinking down into it. And then I'm gonna go to my 3rd spot, shimmy down after 5 breaths, but I'm gonna show you the next progression is to get something to double a cross ball, something that has some girth to it that'll get right in between the shoulder blades, the spine's right here, getting into those muscles, getting into the rib cage, inside the shoulder blades, and getting mobility through this area of my back, because when this moves really well, it takes stress off my neck, off my shoulders, and off my lower back. So we're gonna do 4 spots on the back. I did 2 of them, the bottom 2. If this is my shoulder blade, the bottom 2 were 1, 2. Then now I'm gonna go here, 3 and 4. So I'm gonna lay this down. I would start at the bottom right here underneath the shoulder blades. This is much more intense, but it's not painful for me, and so we need you to gauge that. Chin tuck. If your back is stiff, then it's gonna make your head do this, and you're gonna be a neck extension. So I always suggest you get a towel roll or a pillow, put it underneath your head so that you can chin tuck right here. We want this to be relaxed. So I'll go here, I do my 5 breaths, my 2nd spot, 1 inch down, adjust, sinking down, 5 breaths. I go to my 3rd spot, it's right close to the top of the shoulder blade. I get into position, chin tuck, knees bent. I may not be relaxing well, but you should. You can relax with this. 5 breaths. This is one of our clients' favorite exercises because you can hang out, watch TV, and really work on mobility. My 3rd spot is just at the top of the shoulder blades. See if you can see that right there. Just at the top of the shoulder blades. I put this little pillow, little towel underneath my head, chin tuck, knees stay bent. If So you can get up into this position. This is not a good position for me with the double across balls right here because my elbows can't lay down. So that is too extreme. So I'm gonna get to a position that I can tolerate, and this one right here, arms to the side, is just fine for me. So relaxing those muscles, chin tucked, knees stay bent. So 5 breaths, sinking down into that. So now I've worked on ankle mobility. So you hear all those pops, that was not planned. So ankle mobility, hip mobility, fire up the hips, fire up the ankle muscles so we gain it, and then work on thoracic mobility. That is gonna unravel the seated position. So follow us for more videos on exactly what you can do to fix your body and get out of pain. We'll see you in the next video.